So, I mean, despite the fact that it was a late entrant into the market, it has really sort of been an important option for those of us that have patients that have very severe disease, and especially those that have comorbid disease, including those that have comorbid nasal polyposis or certainly atopic dermatitis. And so I think that, despite the fact that it was late, its efficacy, speaks for itself. It's one of the most efficacious of the biologics that we use for severe asthma, especially in comparison to, I think, the first generation biologic, which was really Xolair. If you were to try to compare the two, we have many patients who have failed other therapies, including Xolair and subsequently other therapies that target IL-5. And Dupilumab has really been a nice option for those individuals that have failed those therapies or have comorbid disease. So, I mean, I think there's been a significant amount of market penetration. I think it's variable depending upon what group of individuals you look at. So, I think certainly amongst allergists and those of us that see the importance of type 2 inflammation in the pathology of asthma, it's been an important option. I think there's been a little bit of a slower uptake, in part because I think marketing relating to the importance of eosinophils and the knowledge about eosinophils that pulmonologists have. And so I think it's a little bit more simplistic for them to think about eosinophils than it is to think about type 2 inflammation. As a result of that, I think I see them really using the anti-IL-5 agents a little bit more than they are using Dupilumab. But I think, again, as we see patients that have comorbid nasal polyps, that have ultra severe disease, or who are having a suboptimal response to one of the anti-IL-5 agents, they're I think becoming more accustomed to using Dupilumab. Not to say that it should be pegged as a medicine that's only used in people who have failed other therapies, but I think that's sort of the entry point for them, as they start to say, oh, well, I've seen people fail on this, and then I've seen them succeed with this. I think as that happens, they will become more apt to use it earlier as a therapeutic option when they have their patients that have severe disease, whether it be just severe disease or even oral steroid dependent asthma.